The only reason we need this legislation is because of the shameful fact that we have a two-tier health system. And consequently, huge numbers of people, nearly half the people in this country, are so frightened of what happens to them when they get sick, given the state of the public health system, that they feel it necessary to pay out large sums of money every year in order to give them the insurance that they might access private health care in the event that they are sick. They do it out of fear. And it is not their fault, obviously, that they are afraid. It is the fault of government that they preside over a public health service that is failing people so disastrously. And that is not in any way a criticism of the heroic healthcare staff and professionals that we have in the public health service under the most extraordinarily difficult circumstances. The nurses, the midwives, the doctors, the porters, the orderlies, the cleaners, the allied health professionals do their very, very, very best for people, but they are crushed by the lack of adequate and safe, for the most part, safe staffing in our hospitals and in our health services, and they are dealing with massive backlogs, with record numbers of people. This month in particular, the highest number of people in trolleys on record in the month of November. So when people are faced with that sort of disastrous situation in our public health service, it is no wonder that they are terrified into having to take out private health insurance. But it is a source of shame that that is the situation that we have, that people are encouraged to buy into the idea that if you have money, you can get a better standard and quality of healthcare than if you don't. And as Deputy Murnane O'Connor has pointed out, as the cost of living crisis impacts on huge numbers of working people, where they have to make very, very difficult choices about the cost of heating their home, the cost of feeding their family, the costs of just about everything going up, that in that situation the pressure comes on for people to think, well, I can't really afford the private health insurance premiums and I'll let them drop, with all the associated fear that goes with that. And I was asked by somebody who suffered a tragedy recently to read something into the record. I would only do it because they have, and it's pretty harrowing, but you kind of understand the sense of despair and anger that people feel when they go through situations like this. I won't have a chance to read it all, but it's from Karen. I won't give her second name. But Karen, and she writes the following: "This letter is mainly about the health service and what all the ministers of health and all past and present governments did or are doing to help, which is basically nothing to change the system. On the 6th of November 2022, my brother passed away. It took 55 minutes for an ambulance to arrive to my family home, 55 minutes due to your cuts. My family lives 10 minutes away from St. Vincent's University Hospital, and it still took 55 minutes. We couldn't get him down the stairs, get him out to a car. We needed help. We needed our healthcare providers. He needed them to save his life. That night was a complete nightmare for us. Being helpless, being told after ringing a few times it was on the way, watching out windows and doors, waiting on help. I live further away from my family home, his home, and I arrived before the ambulance did. He was still alive when I arrived. He was in so much pain. He wasn't a drinker or on drugs. We will have to wait to find out how and why he passed." She goes on, I won't get into the political stuff, but she goes on to absolutely castigate the parties of government. She's very explicit in the letter of not blaming the ambulance workers, who she said were wonderful when they arrived, but places the blame for all of this squarely on the shoulders of government. Now, you ask yourself, why was that ambulance, why did it take 55 minutes to get a 10-minute journey from St. Vincent's Hospital? And I think we probably know the answer, because the ambulance drivers tell us this, that they are sitting outside the emergency departments because those emergency departments are overrun and they can't discharge people from ambulances. And so they sit in a queue in St. Vincent's Hospital and other hospitals, and therefore aren't able to go out as quickly as they should on calls even 10 minutes away from the hospital. Now, why is that happening? Well, another letter that I got this week kind of explains, because it's to do with staffing and our inability to staff the public health service. And I got a letter this week from student nurses and midwives, and it reads as the following. Dear Deputy, student nurses and midwives are working and training in unprecedented conditions in the health service. On top of this, the government has failed to implement an agreed report to address significant costs associated with travel, subsistence, accommodation and uniform costs associated with our clinical placements. We are affected by the same cost of living challenges as our qualified colleagues, with many of us struggling to meet the costs of transportation, fuel, heating, accommodation and other necessities required for students to complete our training, including the additional burden of obtaining accommodation away from home during placements and the cost of acquiring and laundering uniforms. The McHugh report, originally published in August 2021 and accepted by the government, was aimed at bringing allowances for student nurses and midwives in line with the expenses incurred as part of their training, and recognising the additional challenges placed on students while they made their extraordinary contribution to the frontline pandemic workforce. However, many recommendations of this report, which were due to be implemented by September 2022, have yet to be implemented, and student nurses and midwives continue to struggle to meet the costs of our training. She goes on, I haven't got time to read it all, about the enhanced reimbursement scheme for student nurses and midwives, travel costs, subsistence costs, the fact that even just to go to work each day they're paying about €9 in parking charges, the cost of uniforms that they were promised that would be given, and indeed just a simple thing of the cost of laundering those uniforms. The COVID-19 pandemic proved the student nurses and midwives are an essential part, she carries on, essential part of the healthcare workforce in Ireland, and that recognising our high level of skills and training was an important part of keeping those skills in the Irish health service. The long delay in implementing these measures undermines that recognition and shows complete disregard to us as student nurses and midwives, and will not encourage the current cohort of students to build their careers in the Irish health service where they are so badly needed. Furthermore, this delay has no regard for the very significant cost of living pressures we are experiencing, and she goes on to plead with the Minister to address that. Now, you see, you put the two things together. If this is how we treat our student nurses, is it any wonder that the vast majority of them say, as they have said in survey after survey, that once they qualify, they're leaving the country? And consequently, we are massively understaffed in hospitals, so that when ambulances arrive up at St. Vincent's or any other hospital, there's not enough staff to deal with the people there and to open the wards and the beds, often beds that are sitting there empty, but where we don't have the staff to open up those beds. But, of course, you can then listen to the radio and you'll hear the ads for the private hospitals. Come to us. Come to us. No queues there. If you've got the private health insurance, if you can afford, and indeed there's a sort of a hierarchy, isn't there? You know, you can get a better package of health insurance depending how much money you have. That's abhorrent. It's obscene. It's obscene that we have the health capacity, or much of the health capacity we actually need to have a decent and dignified health service, but it's only available to those who can pay. And then you have a situation in our public health service where we can't retain and recruit the staff that we need to prevent the sort of tragedy that woman and her family had to get through because we don't treat the staff properly. So in conclusion, Minister, I would say we have to have a national health service, cradle to the grave healthcare, not a two-tier system, not a system where the healthcare you get is dependent on how much private health insurance you could get. And indeed, the idea that you have a private health insurance market, frankly, is abhorrent, that people are profiting out of this health misery so many people are suffering. We need to do away with that two-tier system, but in order for that to happen, we need to resource the health service and, crucially, to treat the people who work in it properly so that we can actually recruit and retain those nurses, the allied health professionals, so that they want to work in a health service that actually delivers decent health care for everybody in this country, regardless of the size of their pocket.